It's been a debate from ages. Is FUE better or FUT better for hair transplant? Now let me first tell you what are the differences between FUE and FUT. In FUE, what we do is it's called follicular unit extraction, where we take single follicles from the back of the head and then transplant it to the front of the head, one by one, one by one, one by one. Now this is called as follicular unit extraction, that is FUE technique. This is currently the most popular technique, mainly because there is no long-term scarring on the back of the head and there is no surgical cuts involved. Now what is FUT? Now FUT technique is where we take a strip of hair bearing skin from the back of the head. We make a cut, take out a strip and then dissect out each hair follicles and take those follicles and put it into the front where the hair transplant is required. Now what this results is obviously a scar on the back of the head, but that scar is usually very well hidden under the hair with the rest of the hair, and the results of the FUT are equivalent to FUE. But just because there is a cut involved and a scar involved, more and more people are preferring FUE over FUT. Now when do we do FUT? Because we have also kind of slowly migrated towards FUE for most of our cases, but still there are some indications where we do FUT. What are these indications? FUT is where, for example, a very young person needs hair transplant. He's lost all his hair and is still in his early 20s or even sometimes teenage, like 18, 19. And if that kind of a patient requires hair transplant, you can almost be sure that he will require another hair transplant in maybe 10 to 15 years of age. So we can't take out all the hair from the back using the FUE technique. So that's why what we usually offer is something called as an FUT technique, where you take the strip out so that his rest of the donor area on the back of the head is still intact. So if he or she ever requires a second procedure later on, then the donor area is still intact. So these are the kind of scenarios where we prefer FUT over FUE. But otherwise, on a day-to-day basis, 90% of our patients undergo FUE technique.